Hello and welcome everyone. Today we are discussing about thyroid. We are going to talk about anatomy, histology and pathology related to thyroid gland. Introduction. The thyroid gland is a midline structure located in anterior neck. The thyroid functions as an endocrine gland and it is responsible for producing thyroid hormone and calcitonin. It is contributing to regulation of metabolism, growth, serum concentration of electrolytes such as calcium. Anatomy. The thyroid gland is butterfly shaped, vascular, red-brown endocrine organ situated in midline of anterior neck. Under normal circumstances, it is located inferior to laryngeal thyroid cartilage, extends from C5 to T1. On an average, the gland weighs between 15 to 25 gram and is the largest of endocrine glands. The thyroid gland is divided into two lobes that are symmetrical connected by the isthmus which crosses the midline of upper trachea at the second and third tracheal rings. In its anatomical position, the thyroid gland lies posterior to sternothyroid and sternohyoid muscles. Thyroid attaches to trachea via consolidation of connective tissue referred to as lateral suspensory ligament or Barry's ligament. This ligament connects each lobe of thyroid to trachea. The thyroid gland typically contains a pyramidal extension on a posterior most aspects of each lobe referred to as tubercle of Zuckerman. Blood supply. The thyroid gland has an extremely rich blood supply and is estimated to be 6 times as vascular as kidney and approximately 3 to 4 times more vascular than the brain. It receives blood from superior and inferior thyroid arteries. The superior thyroid artery is the first branch of external carotid artery as it arises near the level of superior horn of thyroid cartilage. The superior thyroid artery then moves anterior, inferior and towards the midline behind the sternothyroid muscle to superior pole of lobe of thyroid gland. The thyrocervical trunk arises from anterosuperior surface of subclavian artery and gives rise to 3 branches, one of them being inferior thyroid artery. The inferior thyroid artery branches from thyrocervical trunk at the inner border of anterior scalene muscle and advances medially to thyroid gland. The artery reaches the posterior surface of lateral lobe of thyroid gland at a level of junction of upper 2/3 and lower third of outer border. In 10% of population, there is an additional artery known as thyroid artery. This artery has a variable origin including bronchocephalic trunk, aortic arch, the right common carotid, the subclavian, the pericardiacophrenic artery and the thyrocervical trunk, transverse scapular or internal thoracic artery. It supplies the isthmus and anterior thyroid gland. The thyroid gland is drained via superior, middle and inferior thyroid veins. The middle and superior thyroid veins drains into internal jugular vein on either side of neck. The drainage of inferior thyroid vein may enter either the subclavian or bronchocephalic veins. Lymphatic drainage of thyroid gland involves the lower deep cervical, prelaryngeal, pretracheal and paratracheal nodes. The autonomic nervous system primarily innervates the thyroid gland. The vagus nerve provides the main parasympathetic fibers while sympathetic fibers originates from inferior, middle and superior ganglia of sympathetic trunk. The autonomic nervous system does not play a role in control of hormonal production or secretion but mostly influences the vasculature. Ectopic thyroid. Ectopic thyroid tissue can be found anywhere along the migratory pathway in locations ranging from tongue to diaphragm. The most common site for ectopic thyroid tissue is ectopic lingual thyroid at the base of tongue. Now let's learn histology. The thyroid gland is divided into lobules by septa deeping from the capsule. The thyroid lobule consists of many typical units called thyroid follicles. The thyroid follicles are the structural and the functional units of thyroid gland. They are spherical and their wall is made up of large number of cuboidal cells. They are follicular cells. The follicular cells are derivatives of endoderm and secrete thyroid hormone. The circulating form of this hormone is thyroxine, which is tetraiodothyronine, along with a small quantity of triiodothyronine. In between these thyroid follicles or within the walls of thyroid follicles, we find the small C cells known as parafollicular cells. These are derived from neural crest cells and secrete polypeptide hormones known as calcitonin. The calcitonin helps deposit calcium and phosphate in skeletal and other tissues, leading to hypocalcemia. This function is opposite of parathormone. The thyroid follicles act as a storage compartment filled with a substance called colloid. This colloid is a thyroglobulin, which is nothing but an acidophilic secretory glycoprotein that is Pas positive. Two capsules entirely cover the thyroid gland, true capsule and false capsule. True capsule is peripheral condensation of glandular tissue and false capsule is a pretracheal layer of deep cervical fascia. The gland is surrounded by a thin fibroelastic true capsule. This capsule in turn is covered by pretracheal fascia from the outside and act as a false capsule. The follicular cells are the lining of thyroid follicle. When the follicles are in resting stage, the follicular cells are flat with abundant colloid within the cavity. When the follicular cells are highly active, the follicular cells are simple columnar with scanty colloid. In the normal state of follicles during the moderate activity, the cells are simple cuboidal and the cavity is filled with reasonable amount of colloid. Parafollicular C cell. These are also known as clear cells or light cells. The C stands for calcitonin or clear. These are large, polyhedral, pale staining cells with oval and eccentric nuclei. They are widely distributed between follicular cells and their basement membrane. They also lie between adjoining follicular cells but do not reach the lumen. Now let's learn the pathology. First is benign lesions. Most common benign lesion associated with thyroid gland is goiter. Goiter is an enlargement of thyroid gland which is a disease state. Two types of goiter. First is parenchymatous goiter and second is colloid goiter. In parenchymatous goiter, the enlargement of thyroid is because of hypertrophy and hyperplasia of parenchyma, and in colloid goiter there is an enlargement of gland because of excessive production of colloid within thyroid follicles. Other lesions are Graves' disease, follicular adenoma and thyroiditis. Various tumors associated with thyroid glands are follicular carcinoma, papillary carcinoma, anaplastic carcinoma, medullary carcinoma. These are the references for this video. Hope you like it. Thank you. Bye. See you in the next video.